Good evening, everyone. I'm Lissy Bastian with your Jcn Evening News for this Wednesday, August 5th. Thanks for joining us. As the country tackles a second surge of COVID-19 cases, it's been revealed that at least 30 immigration officers have tested positive for the virus. While it has not been revealed where and when they may have contracted the virus, within the last several weeks, immigration officers have had to interact with migrants apprehended in Bahamian waters. With the details, we go to JCN's Leah Cooper.
You said immigration officers tested positive. Can you give us on how many?
We got no less than 30.
That's Immigration Minister Ellsworth Johnson, who's declining to comment any further on the amount of immigration officers that have tested positive for COVID-19. Our news team also reached out to Vice President of the Bahamas Customs and Immigration Allied Workers Union, Deron Brooks, who says the general concern of his members is that officers don't have personal protective equipment required to give them a fighting chance in the face of the COVID-19 pandemic.
They're equipped with the basic things like gloves and masks, but the level of equipment that you would see the Defense Force using or medical personnel using, that's what we've tried to request. Because of the global environment now, we can't take anything for granted. Now, the officers are willing to go above and beyond the call of duty. There's a certain level of risk associated with the job that you signed up for, but they need to work in as safe an environment as possible.
Mr. Brooks adds that union members believe that the Department of Immigration should have planned for a time like this.
A little over a month ago, if we had told them that a number of officers could have been placed in quarantine because of exposure to the virus, they would have told us that that's a hypothetical scenario that really couldn't happen. But here it is. You had a few weeks back, you had a number of officers in Grand Bahama that would have been placed in quarantine, and I think there are like about 3 left that are still in quarantine, maybe 2 or 3 left that are still in quarantine. And now the same thing happened in Nassau. So we just feel as though the department is not prepared for this eventuality. Because of the nature of the global environment, these things can happen. Of course, we're concerned about the protection and safety of customs and immigration personnel, right? Because working at the borders, you're going to come in contact with different people.
Now, our news team tried to reach out to Immigration Director Clarence Russell, but was unsuccessful up to news time. Reporting for JCN News, I'm Leah Cooper.
Still on immigration news, when it comes to repatriation of illegal migrants to their home countries, Minister of Immigration Ellsworth Johnson says that his ministry cannot afford the constant repatriation of undocumented migrants that arrive or may already be in the Bahamas.
We now have to go through the process where we have to send these persons back home. We don't have the funds to constantly have to take persons into custody and spend thousands of dollars to have Bahamas there or a private entity fly them back to their country. And so I want Bahamians to partner with the government to deal with this. You have to find medical and health care for frontline workers, for persons in terms of who have to go to the hospital. We know that you can't really go to the hospital now. These are difficult times, and I'm hoping that Bahamians do not allow people to abuse our country.
These comments coming just days after a group of 44 Haitian migrants were apprehended in central Bahamas. The group consisted of 35 males and 9 females and were apprehended shortly after 3 p.m. Sunday. Minister Johnson not only spoke from a financial standpoint, but from a health perspective as well, as the country continues to battle with the COVID-19 pandemic.
But there's more than just a financial cost. And I guess it's a financial cost if people get sick. It's a life cost, because we have immigration officers who have tested positive and who are now quarantined, and we know that COVID-19, I've experienced it. I've lost a sister. So you're talking about in terms of cost, you're talking about someone being dead. That's the ultimate cost that we're having to pay in this when people are irresponsible. And so I want persons to take this very seriously.
Mr. Johnson contends that frontline workers like immigration officers, police enforcement, and healthcare workers are putting their lives on the line every day as they offer services that the country needs, again urging Bahamians to take this COVID-19 pandemic very serious. While a national lockdown was something most Bahamians feared, that lockdown kicked in last night at 10 p.m. and is continuous until 5 a.m. Wednesday, August 19th. And we're still in unprecedented times, according to Deputy Prime Minister and Minister of Finance Peter Turnquest, who spoke of the unprecedented situations that arose that has led to Prime Minister Dr. Hubert Minnis' decision to place the nation on a 2-week lockdown. When asked if the government is currently formulating any plans to balance the country's economy and health, the Deputy Prime Minister told reporters this.
So I think everybody would have to admit that there were some unexpected developments as a result of the previous opening. For instance, we could not have anticipated that people would have rushed to travel and may not have been as careful as the situation would have warranted. And as a result of that, we have the cases that we have. So we've learned the lessons from that, and I think when we get past this current lockdown, we will have additional tools available to us. We will be a bit more vigilant about the testing and the quarantining.
Mr. Turnquest noted that the Ministry of Health is also working very hard to assist during this pandemic.
You talked about food assistance. Now, I know that in the past presentations from the Prime Minister, you talked about food assistance. Can you give us a clarity about what direction the rental assistance is going?
Well, the Social Services Department has always had a rental assistance program. That has been ramped up somewhat to be able to address some of these new cases. So they will continue to do what they can with the resources that are available to them, and of course we have increased the allocations to them this year, and so they will do what they can to assist as best they can.
When you talked about testing, are you able to tell us a little bit more about that?
Again, I'll leave that to the Ministry of Health. Okay?
Yeah. Thank you so much. Glad to hear that you're feeling better.
Yes, I'm good.
Just last month, Mr. Turnquest assured the public that the Bahamas will rebound as tourism reopens and the destination recalibrates. Well, frontline healthcare workers sounded the alarm yesterday, expressing their concerns as the country continues to grapple with this second wave of COVID-19 cases. Healthcare workers at the Princess Margaret Hospital, inclusive of staff, nurses, and doctors, called in sick, according to union representatives. Bahamas Doctors Union President Dr. Melisande Bassett told reporters that the hospital has a finite capacity to hold patients as there's an increase in the number of cases. She noted that workers are at their breaking point due to the overwhelming numbers of suspected cases presented at the Accident Emergency Department of PMH.
As it stands, all of our isolation rooms are occupied. And as you know, with the COVID-19 case, they should be in negative pressure rooms, even under investigation, until that can be ruled out. Now, with the hurricane, we would have lost 4 standalone rooms in the legacy unit. They have yet to be opened. We need those opened up. And we need additional rooms, additional spaces to account for the number of patients that we are seeing on a daily basis.
In light of this, healthcare workers walked out yesterday as many were worried about the risk to themselves, families, and other patients.
We need a place to evaluate these patients in a safe manner, in a protected environment, so that we don't compromise those that are COVID negative, ourselves, and the general public. So we're at impasse. We're in a country right now. It's an emergency situation that needs to be addressed so that the public is safe and my staff or our staff is safe as well. We need to ensure that they have the proper PPEs, that's face mask, face shield, as well as proper covering for the type of exposure that they're being exposed.
Now, she says there have even been reports of both doctors and nurses being a part of the rising number of positive COVID-19 cases over the last month. Dr. Bassett explained how their time off will be treated if they present positive with COVID-19.
Told that if we do have a positive COVID test, it won't be considered an industrial-related incident. And any time off has to come out of your vacation time, which is unfair. If I'm being unduly exposed to patients that are intubated with not the proper care, with not the proper surroundings, it's unfair to ask me to give up 2 weeks of my vacation or more to self-isolate because I wasn't protected. That's point number one. Point number two, we have several teams that are out because of an inadvertent exposure on the ward in theater. This is not our doing. This is not our fault, and we don't think we should be penalized for this.
Dr. Bassett says the situation is at a boiling point and more needs to be done. You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.